Hello and welcome. I would like to begin by acknowledging that I am presenting today from the traditional and unceded territory of the Lheidli T'enneh. My name is Katie Cornish. I'm a research associate with the Health Research Institute and Knowledge Synthesis Center at the University of Northern British Columbia. And I've had the pleasure of supporting this project that was led by Dr. Chelsea Pelletier and Dr. Caroline Sanders. Our presentation is titled A Family-Centered Approach to Understanding Children's Independent Mobility in Northern BC. So first of all, let's start with what is children's independent mobility? Children's independent mobility represents the ability for children to move independently through public and private spaces in their neighborhoods and communities. It has also been called active free play. Children's independent mobility can include active travel, things like how kids get to school on their own, maybe walking or riding a bike, or any indoor or outdoor unstructured or unorganized play without adult supervision. So now, why do we want to study children's independent mobility and why might it be important? So there is evidence of generational decline in Western nations. So this means that kids are playing less and they're playing differently than they have in previous generations. So we're also seeing an increased reliance on vehicles, meaning that there's longer distances to places like school and more traffic that is making roadways less safe for children. Research has also shown that there are a number of benefits to unsupervised and unstructured play. Things like greater physical activity, not just as children, but throughout the lifespan, improved risk assessment, better wayfinding skills, and improved self-confidence and self-esteem. Purpose and guiding questions. So this study was designed to describe and document children's experiences of independent mobility from their own perspectives and have conversations with parents and children together to better understand the factors that influence children's independent mobility in northern and rural communities. The makeup of our team, which included researchers, community members as key advisors, and family partners, was a key part of this project's success. So on to our methods. We used a family-centered approach when conducting interviews, meaning we spoke with parents and children together over Zoom. We recruited participants from across the Northern Health region, and data collection took place between September and December of 2020. Eligible families needed to live in northern BC and have a child in their household between the ages of 7 and 12. So, how did the interview process work? Our community partners circulated recruitment posters widely throughout their networks. Once eligibility was confirmed, we scheduled pre-screened conversations with parents and children, often together. At this short call, we introduced ourselves and provided information about the study and explained how participation worked. So we asked that children between the pre-screen and the interview, which was typically about a week, create a drawing, a map, or take photos of places that they liked to play when they were unsupervised or where they liked to go when they were playing in their neighborhood. We chose this method to support children who may have trouble finding words or stranger anxiety, some shyness, and those that are easily distracted or have short attention spans. And we wanted to keep interviews fun and informal. So at the start of the interview, we asked if the child made anything or took any photos and if we could see them and talk about them. Children were asked questions like, can you tell me about a time when you've gone to the park or played in your neighborhood by yourself or with your friends? We also asked questions about how they got to school and who they liked to play with. Parent questions asked what parents thought about their child moving around the neighborhood without adult supervision, and about times when they let their child travel alone or with others, and what influenced their decisions about what their child was or was not allowed to do. We also asked about parents' own experiences growing up. So now on to some characteristics of our participants. So we had 21 individual households participate with a total of 45 participants. 22 were parents and 23 were children. We had some instances of more than one parent being present, and we had some instances of one parent and more than one child being present. So 95% of our parents identified as women, and of our child participants, 61% identified as boys. So we had participants from 5 different communities. We had 19 of the 21 households. Those children contributed some kind of art component, which was fabulous. More than half of our households had a dog. 34% of children had a cell phone or access to a phone that either had Wi-Fi or data for texting. And all of our families lived in single-family detached homes, and almost 24% identified some kind of learning or accessibility need within their home. So interview transcripts and the art components were retained for qualitative data analysis. 4 main themes were identified from the interview data. And from here on out, all of the pictures I'm going to show you have been from our participants. So our first theme was natural places, spaces, and forces. This theme considers factors that impact the types of places that kids like to play in. So this was notably green and wild spaces. We included natural forces because both children and parents were concerned about forces within the natural environment relating to play in wild spaces. So these were notably things like wildlife encounters. Both parents and children were worried about wildlife encounters, but at the same time, when asked, most of the children knew and could tell us what to do if or when they ran into, say, a bear or a moose. So here in the bottom corner, you can see a photo of hockey on the lake over here. And this is from one of our participants. So it's out of season for bears, but you could definitely see how a situation like this could result in some type of wildlife encounters. So our second theme is embracing informal and unstructured play destinations. Similarly to the types of places kids described in conversations and showed us in photos, maps, and videos, they weren't always the types of spots that you might think of as a destination as an adult, for example. So some destinations that kids wanted to go to were places like climbable trees, patches of berries for picking and snacking, specific curbs for skateboarding, or hand-built jumps in the woods that they could take their bikes over. So here in this corner, you can see a handmade bike jump in progress, and this was made by one of our participants and their friends. A few of our participants were pretty big into building these jumps and testing them out themselves. So our third theme from our conversations with families was decision making and knowing when they're ready. So how do we know? So we asked parents to tell us about what made them think their child was ready or not to go to new places, farther distances, or simply begin going places or moving through the neighborhood on their own. Parents talked about things like knowing their child's personality, trusting them to make the right choices, their level of maturity, their physical abilities even, and parents' and child's levels of anxiety around independence. Also things like fear of judgment and social pressure from others. Some parents talked about how necessity was a driver of independence, and this was especially prevalent during COVID. So here on the left, you can see, or this one here, you can see a drawing from one of our participants. So this is a local tree that they like to go to and play at with their sibling, but they're only allowed to go with their sibling, not by themselves. And our final theme is neighborhoods and community environments. Both children and parents talked about how aspects of the built environments acted as barriers and facilitators to independent mobility. Parents pointed out things like lack of sidewalks, busy roads, highways, train crossings, and lack of streetlights as barriers. At the same time, small communities with light traffic offered safer, in the parents' eyes, places for kids to start moving between places on their own. Parents also talked about the social fabric and community of small towns, knowing and recognizing most of the other members of the community, and the belief that other families and adults would do the right thing if their child needed help, just as they would if they encountered another family's child. So these are all things that were identified to be facilitators of independent mobility. So on the right, you can see a photo, or this one here, you can see a photo of a skate park. It's another popular destination in the built environment for participants in our study. However, sometimes parents were concerned about children going to skate parks on their own because of things like traffic, animals, and busy road crossings. So here I've got a sample of some of the art and the pictures that were made for us by the children that participated in our study. So we've got a nice mix of imaginative play over here. We've got playing with siblings, things like seasonal activities and active travel to and from school, and just some formal and informal play settings. So some kids also drew us maps, which were helpful, and they identified things that only kids or children might recognize. So as you can see in this one here, this child identified a dog, this little brown bit right here, that barked and jumped at a fence when they walked between their school and their friend's house, and it frightened them and they didn't like it. So it's just interesting that kids will note some of these things on their maps. So we conducted the analysis of our transcripts first to inform our thinking and looking at the differences between what was discussed in conversations and what was demonstrated in the art components from kids. So this model that you can see was made by combining transcripts and art, and we used the socio-ecological model to guide our thinking in this process. So we chose this model because it considers some of the complex interplay between individuals, relationships, communities, and societal factors. So it helps us to think broadly about the different spheres of influence and how these factors can influence children's independent mobility. So starting at the bottom, we identified some individual factors of both parents and children. So children, these varied and included things like personality, maturity, birth order, age and gender, proximity to friends, neighbors, and sometimes grandparents, as well as phone access and physical abilities. For parents, their own childhood experiences, parents' concerns and anxieties, societal pressure and fear of judgment from others, and necessity. Sometimes children started gaining independence, things like making their way to school on their own or to a trusted neighbors after school. This was driven by necessity. So moving up and out, we have family environments. Things like, are there other children in the home? The family structure, is it one parent, two parents, co-parenting, things like that. Does the household have a dog? Research has demonstrated that dog ownership can often be an indicator of increased physical activity. So we also consider things like communication styles, like how families are connected and how families converse with one another. Moving out again, we have the built environment. So we identified some of the more commonly identified factors like traffic, infrastructure, major roads and highways, green spaces, and supportive neighborhoods. Obviously, traffic and major roads limit children's independent mobility, and supportive neighborhoods, meaning places that were well lit, had sidewalks, and had low traffic, were identified to be supportive. So moving to our outermost sphere, we have culture and society. So here we identified factors like public safety, which includes things like crime rate, perceptions of safety, strangers, and the social opportunities for events and recreation in a community. We also identified some factors that impact all levels of our socio-ecological model. So we called these northern and rural contextual factors. So these included things like weather, so snow and ice, early darkness in the evenings and late in the mornings, wildlife encounters, so moose and bears, and increased distances, as a lot of our communities in the north are spread out and children have to travel farther distances to get to places. So recommendations and next steps. Our team has been thinking about what might be helpful ways to translate these findings. So with support from our community and family partners, we discussed developing tools and resources for parents and kids about framing risks on topics like stranger danger or wildlife encounters. We also have policy suggestions for city planners and those that make infrastructure-related decisions. We suggest making streets more walkable, which includes safe sidewalks that are appropriately cleared of snow and well lit, bike lanes that are not parked in or narrow, and connected safe pathways away from traffic where people can move safely throughout the community. We are also interested in future work, things where we could perhaps measure physical activity and children's independent mobility and compare maybe between rural and urban areas. And of course, we're finally working on an academic manuscript. So in closing, we would like to thank our participants, the parents and the children that took the time to speak with us. We want to thank the children that took photos, drew us pictures, and recorded videos for us to learn from and enjoy. We'd also like to thank our research team partners, Gloria Fox, Janessa Ellis, Erica McLean, and Stacy Pickering for their support and guidance. And of course, we'd like to thank the BC Support Unit for funding this project. And finally, on this last slide, you can see my contact and our references, and I'll be available after the session for questions. So thank you so much.